Hey guys, Wendy here. I'm a registered dietitian nutritionist, exercise physiologist, and amateur boxer. So the question of the day is, what is the difference between a dietitian, a nutritionist, and a health coach? Hey, I'm a dietitian. Oh, so you're like a nutritionist? No. Okay, so what exactly is the difference? So a registered dietitian on the education side, a dietitian requires a graduate degree or a master's degree in dietetics, nutrition, food science, or any related field from an accredited university. They also are required to do a supervised practice, and so like an internship, and that requires at least 1,000 hours of internship hours, usually within a hospital as well as like the community setting. And after that, they do have to complete, dietitians, we have to complete a national board exam after all the other criteria is met. And not only that, we also have to complete continuing educations. So what that means is we have to do continuing educations to keep up with the current science in order to provide the best care and so forth, because research is always changing. And so we have to keep up with the current recommendations in order to provide the best outcomes for our clients. So what exactly is our scope of practice? Is we used evidence-based practice to improve patient or client outcomes by applying the most effective interventions and care strategies. So what that means is that we use evidence. And so let's just use this as an example. I know supplements are a very popular subject for this matter, so we use evidence-based practice to determine which supplements are the most effective, maybe the amount of time given when it works, maybe there's gender differences, the time frame, and which ones cause the least harm to the population. And so with that, dietitians are also qualified to provide what's called medical nutrition therapy, and that involves creating individualized nutrition plans for people with specific health conditions. And so that means that we can work in hospitals or clinics, private practice, community nutrition, and food service. So we are allowed to legally provide medical nutrition therapy. But not only that, as you heard me say, we can also work in food service, such as elementary schools or the hospital nutrition services. And we can also work for the government, like the prison systems or the VA. And then in the community setting, we can provide education, like being a professor, working for women and children, other nonprofits, assisted living facilities, or even research. Okay, so with that, let's skip up to what a nutritionist is. So anyone can be a nutritionist. So in education and training, it varies. The term nutritionist is less regulated, and the qualifications can vary widely. So some nutritionists can have advanced degrees in nutrition or related fields, while others may have completed only short-term courses or certifications. And some nutritionists might have certifications from non-accredited programs or organizations. Have you ever seen advertisements that said, oh, earn your nutrition degree in 30 days or less, or some where you don't actually have to do any courses, you just have to take an exam and then you can get your certification in nutrition as a nutritionist right then. Have you ever seen any of those? And so what exactly is a scope of practice for a nutritionist? And so once again, it varies, and while it also varies from state to state, some nutritionists have substantial training and you're able to provide some sound nutrition advice. For example, there's functional nutritionists, and then there's also some that, like I said before, that require 30 days or less. But nutritionists are not qualified to provide medical nutrition therapy. So what that means is that someone comes to you and they have diabetes, high blood pressure, and they're asking for advice on how to lower or prevent any more effects from their medical disease. It's highly advised that the nutritionists refer them to a dietitian, as they are legally allowed to offer the medical nutrition advice. So in terms of licensing, in some states the term nutritionist is legally protected and requires specific credentials similar to the registered dietitians. However, in many places, anyone can call themselves a nutritionist regardless of their level of education or certification. And so now, what is a health coach? And so the qualifications and credentials for a health coach is they have certifications from a recognized health coaching organization. Their education background can vary, of course, just like nutritionists, and many actually come from very diverse groups of fields like fitness, wellness, psychology, or even unrelated areas. There are certification programs for health coaches that provide training in behavior change, motivational interviewing, and coaching techniques. So the roles and responsibilities of a health coach is a little bit more broad. So like the word health is a broad term that is, nutrition health. Is it physical health? Is it mental health, social health, holistic health? And so health coaches help clients set and achieve health-related goals such as weight loss, stress reduction, improving physical fitness, and then they can also provide support and encouragement and also accountability, and they often focus on lifestyle changes rather than specific nutrition advice. Although if they do want nutrition advice, they can give that. Just know that there are several other aspects of being an overall health coach rather than just specifying in nutrition. So they're more focused on setting goals based on tailored to what your needs are. And so then that means they can work in all sorts of settings like private practice, wellness centers, corporate wellness programs. You'll see apps. You'll also see other online platforms as well. A big term is just to kind of help keep up with that accountability. In summary, dietitians are highly trained and regulated professionals specializing in medical nutrition therapy. We can also be specialized, so we can be specialized in weight loss. We can be specialized in pediatrics or kids. We can get specialized in sports. That's called the CSSD. We can get specialized in kidney, specialized in diabetes. There's a lot of different branches to dietetics where you can focus on being a nutrition expert, but then you can be specialized in that field, almost like how you have a doctor, but then someone who's a doctor can be an oncologist or a cancer specialist or a nephrologist who's a kidney specialist. So same thing in the realm of dietitians. And then a nutritionist, they often offer general nutrition advice, typically to the healthy population without any medical diseases, and their qualifications can vary widely. And then health coaches focus on supporting clients in making lifestyle changes and achieving health goals, with less emphasis on specific nutrition or medical advice given their broad nature of the term health. In conclusion, when seeking nutrition advice, it's important to understand the credentials and qualifications of the professional. It's crucial to verify which ones you need and which ones are suitable to exactly what it is you want to obtain. Be sure to click on the link below on the Ringside Dietitian for more information.